Hi friends, welcome to Race for Therapy. Myself Raymol P Raju. I am a speech therapist and audiologist. Today we are going to discuss about the prerequisites for speech and language development. One of the most common questions I have come across in our clinics is why my child is not speaking even though he is 2 years. I would suggest the parents to stop worrying about the speech output and rather do check their child's basic requirements that is needed for a normal speech and language development. The first and most important prerequisite for speech and language development is normal hearing. Speech is acquired through the ear and hence a child who has hearing loss will develop a delay in speech and language development. A child detects sounds when he is in a mother's womb. That is around 7 months of pregnancy, the child is able to detect sounds from outside. So, this sense of hearing is so advanced at the time of birth that we can do the hearing screening soon after few days of birth. You can track your child's hearing at home. For that, you have to follow some simple steps. Just check whether the child is responding to unfamiliar sound, how he is responding to a loud sound. Do he give a startled response or does he cry for a very loud or unfamiliar sound? Second thing is how he is distinguishing two sounds. When he hears a doorbell or when he hears a dog barking, does he turn his head towards the sound source or does he cry by the unfamiliar sound? Third point is how he is responding to the speaker. For example, when the mother speaks to a child, does he looking towards the person? Does he maintain an eye contact when mother is speaking? Let me add one more point. All these reactions towards the sound source and the speaker are acquired by the child during the first 5 months of age. Now we will see the second prerequisite for speech and language acquisition. It is a normal vocal tract. If a child has to speak appropriately, he or she needs a normal vocal tract. As we all know, we speak with the air from the lungs and again it's modified by the oral structures like hard palate, soft palate, teeth, tongue and lips. If any disruption in the anatomical structures of our vocal tract may lead to a slurred speech or abnormal speech quality of a child. For example, if a child is having tongue tie, may lead to pronunciation problem. Same way, we can see some kids may have cleft palate or cleft of lip, that is an opening of the lip and palate. This will also lead to a pronunciation problem and also hypernasality of speech. Another point we have to think about is normal neuromotor maturation. That is, speech is a complex and rapid neuromotor activities where we require the brain to work fast to formulate a speech output. Researchers have found that there is a relation between the motor skill, motor development and speech development. For example, if a child starts walking by 1 year, it is normal. But in some cases, we can see there is a delay in motor development. Then probably the child will show a delay in his speech development. The fourth point among the prerequisite is a normal intelligence capacity and cognitive functions. To produce oral language, a child should have the capacity to be more attentive, generalize, recognize and store items in the memory. So first we will take the attention. A child should be able to attend a task at least 2 minute time period. Same way, he should be able to recognize the item. For example, when we are teaching that this is a spoon, this is a plate, he should be able to recognize the item and store it in a memory to produce it later. A child aged 9 to 12 months will be able to develop a process called object permanence. For example, if a child is hungry, he will ask for the biscuit even though he cannot see it. So, by the age of this 1 year, a child who has the concept of object permanence, they will ask for the objects they cannot see. They will try to name it. They will try to label each item. The last and most important factor is, do a child have a nurturing and stimulating environment? For this, you have to think about 3 points. These are very crucial for the acquisition of speech and language. The first one is a positive bond with the caretaker or the parent. This will help the child to communicate in a healthy way. The second point is, do they have a good model at home? They should have a role model to imitate the speech, the style of speech. For example, the parent or the sibling should use a well-formed language pattern so that the child can imitate the same and have a good speech output. The third point is, do they have an exploring situation? Are you allowing your child to explore new situations in life? This will help them to urge communication. To conclude, let me summarize all the prerequisite skills. The first one was normal hearing. All children should undergo a newborn hearing screening test. The second thing is a normal vocal tract. The third point is neuromotor maturation. Fourth point is they should have a normal intellectual development and cognitive development. And the fifth point, we should provide them with a nurturing and stimulating environment. I hope this video was useful and informative to you all. If you like the video, please subscribe and comment and share it to the needy ones. If you have any concerns, do message to my WhatsApp number, which is given in the description box below. See you soon with more videos. This is Raymol signing off.